Uh, Good afternoon, everybody. Appreciate everybody being on here today. This is an important topic. There's no doubt that this is going to be a helpful webinar. I want to thank everybody for being here, our panelists and our participants. And before we get started, I want to take a moment to recognize there are a lot of people hurting right now. Collin County draws its strength from having a diverse community and a rich history of people getting together and working together. And we've been doing great things here in Collin County. People with different beliefs, different religions, different origins. And we live in this diverse and prosperous community. And when I tell other members of Congress about Collin County, I say, you know, I hope one day that the rest of America can be like Collin County. And it's hard to find anybody who disagrees with that. And despite all those blessings that we have as a community, there are many Black Americans right now who are denied equal justice and equal treatment, and even worse, fear for their life because of the color of their skin. And that is not right. And as we mourn the death of George Floyd, we have to come together as a nation to advance equal justice and work to heal the wounds, both institutional and cultural, dividing our country. I encourage you to reach out to me with your ideas and thoughts on this issue. A broad diversity of opinion is helpful and quite honestly is critical at this time. So feel free to reach out to me anytime. I'm happy to discuss this or any other issue that may come to your mind. So with that, let's get started. There's no doubt these are uncertain times, and a lot of folks are listening. They're facing a lot of unknowns, and that's why we're having this event today. We're trying, a lot of us are trying to work from home. We have active young coworkers who are wandering around the house behind us in the background in our Zoom calls, and we're trying to lessen the emotional strain resulting from children missing their friends and normal activities. As a father of 3 young daughters, I know how important it is to keep kids engaged and yet healthy while navigating this new normal. And we are fortunate to be joined by Senior Vice President for the Dallas Market Operations at Children's Health, Dr. Ray Tsai, and Jason Isham, who serves as Director of Integrated Behavioral Health. Dr. Tsai is board certified in pediatrics and clinical informatics. We're lucky to have him with us today. I had the pleasure of meeting him back when I was on the Health and Human Services Committee in the Texas legislature, where I served before I came to Congress. Jason Isham oversees the hospital board's based telebehavioral health program, which partners with schools across North Texas to provide access to mental health services for students receiving telemedicine. Jason is a licensed marriage and family therapist and certified case manager. Before we get started, I want to let you know that if you have a question during the event, you can click on the Q&A button on your screen and you type in your question. We'll get through as many questions as we can in this period of time. This webinar will actually be posted on the website, vantaylor.house.gov. You'll be able to go there. You can watch it again. So if you get through half of this and you've got to go do something important, no problem. You can come back and watch it later. But just so you know, we're going to have a record of this. It will take a couple of days before it gets up on the website. You also want to encourage you, if you want alerts on what's going on regarding coronavirus, go to vantaylor.house.gov/coronavirus alerts. You can sign up for alerts. If you just go to my website, vantaylor.house.gov, at the top link is actually you can click on it. A couple different choices. There's a specific alert tab for families, and we'll actually put that in the Q&A section here during this webinar. There's also one for veterans, one for seniors, one for business owners, one for workers. You can click whatever one applies to you. Feel free to click on that. We're happy to give you that information. We spend a lot of time updating our website and letting people know what's going on to try to help us get through this. And so if you have any questions about the resource information that are not included in today's webinar, please reach out to my office and just call 972-202-4150, or you go to vantaylor.house.gov/contact. You can send me an email. My team and I are here to help. We've been working around the clock for months, helping our district, helping us get through this incredibly difficult time. And so with that, I'm going to turn it over to Dr. Tsai and Mr. Isham.
All right, we'll give them a second to unmute their video and start their, or unmute their audio and start their video.
Hello, and good afternoon, and Congressman Taylor, thank you very much for assembling us together and for inviting Children's Health to be a part of today's webinar. I don't think the video has quite started yet. I've started on my side, but I'll keep going unless I hear otherwise. Children's Health.
You can go ahead.
Okay. Children's Health has had a long relationship with Congressman Taylor, dating back many years, and it's good to hear your voice again, Congressman. Our Children's Medical Center Plano campus has been in the Congressman's district since your time, as you know, in the state legislature. And Children's Health is incredibly grateful to Congressman Taylor for your friendship, your continued leadership, and your dedicated service on behalf of North Texas children and families. I'd like to share a little bit about Children's Health. Many of you on the webinar may be aware of our longstanding history, over 107 years dedicated to taking care of children. We are the leading pediatric health system in North Texas and one of the largest pediatric healthcare providers in the country. We have over 600 licensed beds and almost 5 million square feet of space providing healthcare to children. We will care for about 300,000 children and their families through over 1 million patient visits this year. And about 30,000 of those patients will come from Texas's 3rd congressional district. Children's Health is one of the busiest pediatric emergency rooms in the country, with approximately 170,000 total ED visits between both the Dallas and the Plano campus. Jason and I both appreciate the opportunity to be a resource for your constituents. As background for this discussion today, I think many of us are already aware, COVID-19 has affected about 7 million people across the globe, with 2 million of them being from the United States. 75,000 Texans have been diagnosed with COVID, and we have a lot to learn about this virus. We've learned a lot over the past 2 months, but there's still a lot that we don't know. In forums like this, one of the reasons that Jason and I are particularly pleased to be able to join you today are really an opportunity for us to share information about the transmission, the disease, coping with it, but then hopefully also prevention so that we will see those numbers decrease over the next weeks and months. Almost all of the information that I will share today is from the Centers for Disease Control and Prevention and/or the Texas Department of Health, or our local county health departments are also publishing really good information, not only on the number of people diagnosed, but also continued ways to fight the spread of COVID-19. So, I look forward to our conversation today. Jason Isham, you're up next.
Thank you, Ray. And like Dr. Sy, I would like to thank Congressman Taylor for his continued leadership and support of our Plano campus. As Ray mentioned, I know, Congressman Taylor, you've had a long-standing relationship with Children's Health, and we are certainly grateful for that. For the listeners on the panel, I wanted to thank you all for the opportunity to join you today as well. And in my role at Children's Health, I am the Director of Integrated Behavioral Health. And in that role, I lead our school-based telebehavioral health programs as well as our clinic-based integrated behavioral health programs that we'll have the opportunity to talk a little bit more later this afternoon. But I wanted you to know very specifically that one of the things that Children's Health has done as a result of the COVID-19 pandemic to keep our patients safe is to offer telehealth solutions. Children's Health is a national leader in telehealth, and in my program particularly, we've been using telehealth to expand access to behavioral health services beyond our walls since 2017, and our school-based telehealth program started as early as 2014, and that is currently the largest school telehealth program in the country. And so As a national leader in telehealth services, we were well poised to pivot when the pandemic hit and to offer virtual solutions. In my programs, we were offering fully virtual solutions for behavioral health as early as mid-March. And so again, telehealth is just one of the ways that we'll discuss today that Children's Health is working to keep our patients safe in this really unprecedented time, and to let you all know that we plan to continue to be here as we have been for the past 107 years. So that's it for me, and so I'll turn it back over to our moderator.
Thank you. So for everyone listening, again, there is, if you're on a desktop, there is an icon at the bottom of your screen that has Q&A. You can also just use the chat panel to the right of the screen. And so if you have any questions, you can go ahead and start submitting those either via the question and answer icon or just via the chat. But we did receive several questions from folks who have RSVP'd for the event just online on the online portal. So what I'll do is I'll start reading those, and then Dr. Sire, Jason, you guys can determine between the two of you who's the most appropriate to answer the question. Okay, so the first question is, given that children can be a large population of asymptomatic carriers, do physicians think opening schools will lead to a large fall/winter spike in adult cases?
So I'm happy to answer that. I think that most people do believe that a lot of the social distancing and shelter in place that we've gone through over the past few months has certainly reduced the transmission of COVID-19. And so most people would then think that kids going back to school in the fall will likely create an opportunity for the spread of this novel coronavirus between children, and probably then to their family as well. I think that is going to be a really hard decision that the local school districts, I know, are working really diligently with their local health department, with the other physicians and experts that they have on their team, to really balance the benefits of children being in the seats in school with the risk of transmission of COVID-19. And this is probably one of those areas that there isn't a right answer for every school district, for every state, nor, to be honest with you, for every family. Some of the questions that I think were submitted in advance highlighted that some children who may have special needs with special healthcare concerns, and I think that's something that certainly is part of the calculation for every family to weigh in. It would be the risk of their child contracting COVID-19 from going to school, and balancing that with the potential resources they have to be able to frankly keep a child at home. And so I think those are all going to be really tough decisions that, again, every school district and local community will have to decide, but also every family is going to have to make the decision that's best for them.
The next question is, do you have recommendations on how schools can safely resume this coming fall in some sort of a hybrid model?
Yeah, so I think I've seen a few proposed options. I've seen some that would have one half of the students go to school on say Monday, Thursday, and another half go to school on Tuesday, Friday. And you can imagine there's probably many different variations of that. The goal around those hybrid models tend to be to reduce the number of students in school at any given time, which would likely reduce the transmission of COVID-19 between students, and then hopefully, again, to potential other family members and throughout the community. In addition to that, though, I think we all can recognize that regardless of which model the school districts land on, it's going to be imperative for students. And I know I have some young children at home, and so I know this is hard. but to ensure frequent hand washing with soap, to avoid sharing, toys or pencils or other, personal items, with each other, because that's where COVID-19 could spread from one person to another. And, certainly trying to allow for as much, social distancing as you can within, say, a kindergarten environment. I think that most teachers would tell you that would be really, really difficult. And so I think that there are mitigating interventions that we can put into place between us as parents and certainly the schools. But I really do think that, this is going to be a higher risk in the fall as people continue to go back to work, schools reopen even on a limited basis, that hopefully a lot of these mitigating interventions that we put into place will really reduce the spread of it.
Thank you. The next question is, I'm afraid my child is becoming depressed due to lack of interaction with friends. Do you have any recommendations on how to make sure that they are staying connected with others?
Yeah, Jason, I think this is probably right up your alley.
Yep, I'll be happy to take that one. So thank you. So certainly what we've seen with children during this time is a disruption in their routine, a disruption in their ability to connect with their friends physically. And so one of the great things, though, is that we have technologies, much like we're employing today, the Zoom platforms and social media platforms, to be able to connect with one another virtually. And so that is something certainly that we encourage parents to monitor, but also to utilize, particularly in a time like this. The other thing that I would say is to really be mindful and to pay attention to your child's behavior. One of the things that we are always concerned about is when a child's behavior begins to shift. Either their attitude begins to shift, their behavior begins to shift, perhaps they become more withdrawn. If they're normally a very outgoing child, or perhaps if they're more a reserved child, they become a little bit more reactive and acting out. Look for those changes in your child. Depression in children can manifest itself in a lot of different ways. Sometimes we think of depression as just being sadness, but in children it can look a lot of different ways. It can look like hyperactivity, it can look like anxiousness, it can look like physical aggression. You'll also want to look for changes in their sleep patterns. If they're sleeping longer than normal or less than normal, or having trouble going to sleep or getting up, or if they're having changes in their appetites as well. Either they're eating more than normal or also eating less than normal. So paying a lot of attention to your kids during this time, and I know being in close quarters, you'll have that opportunity. The other thing that you can do is look for creative ways to celebrate your kids and their milestones. I know that many students were struggling with not having the ability to take part in those normal developmental milestones, whether that be graduation from elementary school or graduation from high school, prom, those sorts of things this spring. And so encouraging parents to do some creative things. I know in my neighborhood, we were doing drive-by parades for kids with birthdays. And so all the parents were getting in the car with their kids and driving by the homes, and the birthday child would come out and we'd be able to celebrate them in that way. We also did virtual Easter egg hunts during Easter. And so again, looking for those creative ways to provide opportunities for your kids to connect with others, utilizing the virtual technologies that we have. And then I would also just recommend that you utilize some old school ways too, maybe writing letters to one another, to their friends. That's not something that we do very often anymore, but it is a unique way to express your fondness for one another and to connect with one another, really in a way that's different and unique.
Thank you. The next question is, they've heard that heat actually kills the virus. Is this true? And if so, does that mean, in the Texas summer, do we not really have to worry about the virus when outside?
Yeah, this is Ray Sai. So I do think that heat it can kill the virus, certainly in addition to time, and but it still can be infectious. It depends on how long, how hot it is. Usually most respiratory viruses, so the flu and other viruses that cause the common cold, they do tend to not be as common in the summer. And so I do think there's some validity to that. Unfortunately, though, we have seen that, there continues to be pretty consistent numbers of people being diagnosed with COVID-19, despite the fact that, it was almost 100 degrees today. And since Memorial Day, it's been fairly warm. And so I don't think that heat in and of itself, just the regular Texas weather, is going to kill it and eliminate the risk of transmission. But in general, we've seen lower transmission in the summertime. That's probably also for a few other reasons. One is we're more likely to be outside. When we're outside, we're probably running around, walking around, and we're not as in close quarters as we usually are indoors. And so, those things can help. But it probably also makes us more concerned for the fall as temperatures cool down a little bit, and as we get into winter and more people are inside for longer periods of time. Some viruses are more contagious, if you will, during cool, dry weather.
And kind of related to that, Dr. Tsai, is someone asked, does chlorine from the pool kill the virus?
Yeah, that's a good question. So I think it's unlikely that the virus would be transmitted from one swimmer to another, through the water. I think the chlorine in the water is probably sufficient to kill it. What's more likely to happen is when kids are playing in the pool, that, if they're in close quarters and they're yelling, they're having fun, that, sometimes we spit a little bit, and there's that saliva could certainly be a vector of transmission for it. And so I think if kids are just on a swim team and they're swimming in their own lane, they're using different kind of being very cautious when they're in the changing rooms to avoid being too close to one another. I think those are probably fairly safe activities. But if you're kind of horse playing in the pool, which we all know kids will do, and they're jumping around each other, and they're yelling and having fun, that's probably a higher risk activity. Now, if you have probably one or two kids over that pretty well, and they're all trying to, maybe playing pool volleyball or something, that's probably, reasonably safe.
Okay, so we have a question that was just submitted from Daniel, and he said, as summer camps begin to open, many parents, and one thing to note is a lot of parents, really have to send their children to summer camp if they're returning to work. But how can we keep our children safe at these activities or at summer camps?
Yeah, that's a really good question. And if I can share a story, so as I mentioned, I have three young children, and we were evaluating summer camps, for our children. And one is that many people have probably noticed there are fewer camps this summer available than in usual years, likely because of the risk of transmission of COVID-19. And so we were looking at a camp, and there's obviously big differences between sleepaway camps and day camps, and things that you would want to look for in those camps would be, whether on their website or that they have published, that they are adhering to CDC recommendations around trying to allow for social distancing, trying to ensure that they are, cleaning toys or other equipment between campers, trying to, screen for, ill children and immediately notifying their parents so that we can try to keep them separate from well children. But one of the things that we were looking at was a summer camp, a sleepaway camp up in Maine, actually. And my wife had been a counselor there many years ago, and her wish was that our kids would be able to go and experience the same camp that she did. And we read their website, and they said that they were, trying to reduce the amount of campers that could attend at any given time. So that was good. We felt like it was up in Maine, and so the counts up in that community were fairly low. So that was good. And the activities they were known for were all pretty much outdoors, and so we felt pretty good about that. But then the last line was that they were restricting the camp to only in-state Maine residents. They didn't want folks from potentially higher risk communities. And so I think that, a camp like that, if you're looking at camps that are being thoughtful about how to protect their campers and how to, ensure that people are getting a benefit out of attending camp and enjoying it, but yet trying to minimize the risk, I think that's important. And I recognize, our household also, we want to ensure that the kids have an opportunity to, enjoy camp and, experience camp, while at the same time looking for those that are going to, provide a safe and experience as you can.
Thank you. So earlier, I think, Jason, you spoke about this, but the fact that we can use technology to help keep our children connected. One person who had submitted a question though said, how do you know how much screen time is too much though? Obviously parents are relying on devices a lot more, and there's still a balance there as well.
Yeah, absolutely. And so it's a great question. And so I think one of the things that, again, you want to look for is the screen time beginning to have an effect on your child's mood? And again, like Ray, I'll just sort of share personal experiences in that, I have a child going into 7th grade, and obviously video games and iPad tablets are a big deal. And we very much supported that interaction during the school year as we needed to. But now as the summertime has rolled around, there has been a tendency for them to want to spend more time in front of the video screen. And so what I noticed with my son is that when he spends large chunks of time, and I'll say in his case, it's more than, say, an hour and a half at a time, then I begin to notice shifts in his attitude. So again, it goes back to the earlier reflection about really paying attention to your child and what they need and what they can tolerate. The amount of screen time that may affect your child may be different than mine, but I would say begin to monitor at what point does your child's attitude begin to change, at what point do they begin to have changes in their sleep or their appetite, or do they begin to neglect other things, other ways of interacting with people, with your family, and with their friends. So if they are thinking about playing video games in lieu of playing outside and being involved in activities that maybe they had previously enjoyed, then I would say begin to monitor that and begin to put limits on that. One of the great things that we can do as parents for kids who are suffering from anxiety or depression or struggling with screen time is to set a schedule and a routine. And so perhaps we schedule in some screen time activities and connection virtually with other friends in the afternoon when it's really hot, but then encouraging physical activity and being outside in safe ways in the morning or in the late evening when the temperatures have gone down a little bit and it's a little bit more comfortable to be outside. So again, scheduling that routine is really important. And also, as I mentioned before, really being mindful of what's happening with your child. And that may be different than mine, and that's okay. The children respond to these stressors and things very differently. And so the most important thing is to be really in tune with your child and knowing what's going on with them.
The next question we just received is, I've been hearing a lot about Kawasaki disease. How is that tied to COVID? And what should I know about the symptoms?
Yeah, that's a good question. So as background, Kawasaki disease is an inflammatory condition that, there have been a lot of hypotheses in terms of what causes it, but it's been fairly well known for many decades. And what they have, I think what the person who entered the question is asking is around the there's a newer condition that has been recognized with COVID-19. That's the multi-system inflammatory syndrome that is similar to Kawasaki's in terms of the concept that it's an inflammatory response. And so a lot of these children will have fever, they'll have pink eye, they can have a rash, a large lymph node, sometimes some swollen hands or feet, and they usually don't feel good. Like they're usually pretty sick or what we might call irritable. And so there's a belief that this condition is maybe after a COVID-19 infection, about 4 to 6 weeks after, and that it's the body's kind of immune response that has caused this inflammation and this constellation of symptoms. It can be pretty serious, and so a recommendation for not just Kawasaki's disease, which is also, it's thought to be a similar kind of process, but also this pediatric multi-system inflammatory syndrome, is to call your pediatrician. If you think your child is sick, has a lot of these symptoms of the pink eye and the fever, rash, swollen extremities, maybe this is clearly not their self, is to call your pediatrician, call your family doctor, and share with them those concerns. And the CDC has published really good guidance on these conditions. There are some lab tests that you can order to point you in the right direction, but there's not a single lab test that says yes, this is, or no, it's not. This disease. It tends to be kind of the whole picture in its entirety, and kind of evaluating the child. And so it can be pretty serious, and it is again thought to be sequelae of COVID-19. So we could start to see some more pediatric cases of it in North Texas as our volume of cases continues to increase.
Thank you. Our next question is online, and it's what criteria will schools use to make decisions for the upcoming school year? Or how would you advise schools to look at the health situation when making those decisions?
Yeah, that's a good question. And, I do think they will look, and I know that they have spent a lot of time looking at this right now, looking not only at what they will likely do in August, but probably also thresholds for absenteeism and probably rates of infection within the community to course correct and to adjust. Because to be honest with you, like nobody can really predict what this fall will look like for COVID-19 infection. And just given, every winter, I'll say in pediatrics in particular, we are challenged with trying to forecast, when is the flu coming? When is an infection called RSV, or respiratory syncytial virus? When will that infection kind of hit North Texas? And even within that, how severe will it be, this winter compared to a different winter? When you add on the complexity of, COVID-19 on top of those two, standard winter illnesses, it's incredibly hard, and the range of possibilities widens tremendously. So with social distancing and a lot of these potential hybrid or even school, closures like we saw earlier this spring, maybe this winter could be fairly mild and, reduce the transmission of not just COVID-19, but also flu and RSV. On the other hand, the other side of that spectrum, it could be a really burdensome winter, because you will have the flu, RSV, and now a third virus, all kind of, potentially infecting the same pool of people. And it's really anyone's guess in terms of how effective the social distancing and hand washing and other preventative measures are going to prevent the spread of all three of these. But having said that, I do think that your thoughts on, what your school district or what factors your school district should consider, that's probably a good venue is to share that with your school district in terms of what's our concerns or factors that are important to you, so that they can understand what their constituents and what the parents and students that they're serving, what values they have in terms of, what would be most important to them.
Thank you. The next question reads, my son has special needs. Is there any evidence that individuals with disabilities are impacted at a disproportionate rate from COVID-19?
Yeah, I don't think I've seen any explicit studies, particularly in children, but I would say that within the adult experience, certainly those with what they call pre-existing conditions are at higher risk. And this is true for most, certainly respiratory infections. So you might imagine that children who have limited mobility or neuromuscular issues, who are unable to cough as effectively, those who might have immune suppression, whether from cancer treatment, from other immune suppressing illnesses, long-term steroid use. Those children are likely to be also at higher risk for contracting the infection as well. And so I think that it's something to certainly for every family to evaluate as they look at the fall, and again as the schools look at how to reopen safely. I do think that there will be a population of students who are at higher risk for not just contracting the disease, but then also potentially the burden of disease. And I think that's a good conversation to have within your family and with your pediatrician and the school district as well.
Great. Jason, earlier you spoke about symptoms of depression. What should parents do if they do start noticing some of those symptoms in their own children?
Right. So I think the best thing, or one of the best things they can do, Ray's already talked about it, is to talk about it with their pediatrician. Again, in children, many times behavioral health issues will manifest in very similar ways. So oftentimes ADHD will look like anxiety, will also look like depression, especially in young children. And so I think the first step would be to have a conversation with your pediatrician and get their sense of what is happening. For children 11 and up, many pediatric offices will screen for depression as a routine part of the wellness exam. And so there are depression screeners that healthcare professionals can utilize to get a sense of what's happening for kids. In addition to that, many schools will have resources as well. For example, in our school-based telebehavioral health program, we currently support over 85 campuses here in North Texas with behavioral health support. And so historically, we provided that through a telebehavioral health, through a tablet device while the child was at school. Now we're also providing that same care to kids while they're at home during the summer, and also certainly during the pandemic when they were studying at home as well. And so reaching out to their school for resources would be a great place to start as well. In addition to that, just about every community has a local mental health authority that has a broad array of services and the ability to assess children for various behavioral health disorders and assess what their needs are, whether they need to be referred for therapy or for additional psychological testing, or perhaps even a medication evaluation with a psychiatrist. And so I would say first start with your pediatrician and your school, and then there are other behavioral health resources in your community like your local mental health authority as well. You can also reach out to us at Children's Health. We have a website, www.childrens.com/telebehavioral, and we have some resources there as well for parents who are wondering about behavioral health issues in their children.
Thank you. The next question is, should we avoid taking our child to the doctor and to the dentist for routine visits still?
Yeah, that's a good question. And I think, similar to my conversation around camp, I do think it's worthwhile to call your doctor's office, call your dentist's office, and ask them about what preventative features that they have put into place to ensure that your child and you are safe when going to the doctor's office. There are many reasons that it's necessary sometimes to go to the doctor's office. One, that frankly we've seen a reduction in the number of children who are vaccinated for a lot of vaccine preventable diseases. So I think those visits are necessary for ensuring that we don't see a resurgence of chickenpox or whooping cough, for instance. Certainly to go to the dentist to get your routine exams and, unfortunately maybe having to fill in a cavity, those have to be done in person. But there are a lot of doctors and offices, maybe dentist offices too, that are doing more around telehealth. And as Jason shared earlier, that I think is a great idea in light of not only, COVID, but also I think it's more convenient, certainly for patient families as well. Relative to, our hospitals, what we have done to put measures into place to prevent spread, I'd like to share some of those if we have the time, because we want to ensure that the communities that we're serving, and certainly many of the patients that we're serving would be in that high risk category. So we put in many mitigating measures in place, including visitor guidelines, so that we screen for visitors who may be ill or have been recently exposed to COVID. We also are screening our employees. So I'm asked every day whether I feel ill or have any of the symptoms of COVID. We're also mandating that all of us wear the surgical masks while we're in the hospital, so that we can be less likely to spread that not only to our patients but then also to each other. In addition to those, we've also reinforced the social distancing through signage throughout the organization. We've put in contactless check-in. This is really, I think, a great feature. Contactless check-in for ambulatory appointments through MyChart, so that people can enter your insurance information and check in that you're at the office without having to touch any of the kiosks or type in your information again. As I mentioned, we're leveraging our telemedicine through not only behavioral health, but also through many of our specialties as well, including neurology, pulmonology, primary care, et cetera. And then also, this is a really neat thing, recognizing that, frankly, each time that any of us, whether patient families or employees, go out to the grocery store or out in the community, that we do put ourselves at some small amount of risk of contracting COVID-19. We partnered with 7-Eleven to put a pop-up store in our auditorium. So we're not using the auditorium right now because of limiting gatherings. And so we work with 7-Eleven, and they've put in a small store where our employees can get some of those essentials, toilet paper, paper towels, those hard to find items. But then also our employees and our patients can enjoy some of those 7-Eleven favorites and ready to eat foods as well. So really kind of a neat collaboration where we are trying to reduce the likelihood of spread of COVID among not only our patients, but then also our staff as well. So those are some of the things that we put into place across our hospital. I know a lot of other doctors' offices have put in similar sorts of measures, in dentist office as well. So I would call them and ask them, and ask the hard questions. And if they're not doing anything, I think that could be telling.
The next question is, if one of my children gets COVID-19, what should I do as far as my other children go?
Yeah, that's a good question. So this is a respiratory infection that seems to be at least fairly easily transmissible. And so if you identify that one of your children is having symptoms of COVID-19 and they're positive, to be honest with you, I'd probably do a lot of the same things that I do, even pre-COVID. In terms of, I have 3 children at home, and sometimes when one of them gets sick, they get quarantined a little bit. And so we designate, one of us to try to spend more time with them and try to keep them separate in terms of sleeping in a different part of the house, eating, maybe separately from the rest of us. Certainly making sure that if they have fever, that we give them fever control medicine, ensure that they're drinking enough fluids, because like every other respiratory infection, you want to ensure that they're comfortable, that they're not dehydrated, that they're monitor their breathing. But there's no, as you know, there's no medicine that we can take at home to prevent the transmission of COVID-19. And so the best thing to do would be to stay home, try to avoid other people, other children, other household contacts getting ill from it. As I will say to my families, the worst thing is when mom gets sick, because when mom gets sick, the whole household kind of grinds to a halt. And so trying to ensure that everybody else in the family is as healthy as possible, and then keeping an eye on the little one who is obviously not feeling good. The interesting thing about this disease is that it has had fairly, low prevalence within children, and we're very grateful for that. And there's probably a lot of different hypotheses as to why they haven't been as infected as adults, and for the most part, they tend to be exhibiting a milder disease burden than adults, and so those are positives for kids. But keep a close eye on them nonetheless. And as we talked about earlier, kind of a few weeks later, if you see some of the symptoms of the pediatric multisystem inflammatory syndrome, call your pediatrician to voice those concerns as well.
Okay, our next question is, I'm combining 2 questions. This will actually be our last question too. But should I be letting my child play on public playground equipment? And then another question that's kind of tied to it is, can my child play with soccer or basketballs where you're sharing equipment?
Yeah, those are good questions, and I don't think that there is, there's no easy answer to any of these questions. Actually, these have been fantastic questions, and a lot of that is going to be based on your risk tolerance as a family, certainly potential other past medical history or other conditions within not only your child but also probably your family as well. I would say the playgrounds, if you're in a community that's relatively low risk, and you watch your kids, and it's pretty hot outside, and there's nobody else there, and you are using hand sanitizer, it's probably, there is some risk involved, but it's probably not a high risk activity. Playing soccer and being on a team, those are, I think, important childhood experiences. And so there is going to be, some risk to that if they're, close together and they're, yelling and screaming as children should when they're playing sports. And so that's going to be something where, is this a group of, other athletes where, you are fairly confident in, those other families' ability to, self-withdrawal if they're sick. If we all know folks who, even when the kid is sick, they still show up at the birthday party, or, they're playing sports. And, with this, disease circulating, that's probably not the family that you want to be on the soccer team with this fall. But if you evaluate the risks and the benefits of being part of a team, and you are vigilant about hand washing, you are looking for ways to try to mitigate that risk, I do think that there are going to be busy soccer teams this fall, but we just have to try to reduce the risk of exposure, and everyone's got to play a part in that.
Thank you. All right, I think Congressman Taylor's going to hop back on.
Yep, I'm back. I want to say thank you, everybody. We have actually run out of time, and so we're at the end of this. And I just want to say thank you to our two terrific guests, Ray, Jason. Thank you for being with us. Thank you for your expert advice to so many concerned parents here in the 3rd District of Texas. This webinar, again, we will have this on our website in a couple days. Feel free to share it around. We've done, I think this is our 5th one, variety of different topics. People from all over the country actually have come in and looked at these webinars. So a lot of people have looked at them, examined them, found them useful. And if there's something else we can do for you, if we can help you with unemployment, if we can help you with your economic impact check, PPP, getting more information about anything that deals with the federal government, feel free to call my office anytime. Our number 972-202-4150. Go to vantaylor.house.gov, hit contact, or you can email me. We will get back to you and help you work through your problem. So just want to say thank you for being here. We appreciate your participation, and just want to also say that this has been a challenging time, but I have great confidence that Collin County is going to lead Texas in an economic recovery, and Texas is certainly going to lead the nation, and America is going to lead the world in an economic recovery. So I know we've made a lot of sacrifices to beat back COVID-19, and I know that there are still some rough times ahead, but I have great confidence that we've got a good plan and that we're executing it, and that we're going to get to the other side of this, and America at the end of the day is going to be stronger for it. So with that, thank you. Goodbye. God bless.